Assalamu alaikum. So today we're gonna talk about a major descending tract or the pyramidal tract that is called corticospinal tract. So we're gonna discuss everything about the corticospinal tract, its origin, its functions, the whole pathway, lesions, and everything related to it. So stay tuned. So let's start with the definition of the corticospinal tract. The corticospinal tract is a major neural pathway that conveys motor commands from the brain's cortex to the spinal cord, enabling voluntary movement control. So you can see here, as the name suggests, the corticospinal tract. Cortico comes from the word cortex, and spinal is for the spinal cord. So brain's cortex till the spinal cord. Now it's a motor track. Then after this track would terminate, the at that particular point it would actually synapse with the lower motor neuron and ultimately would reach the skeletal muscles or any gland and so on. Okay, so in this way it controls the motor activity. Okay, so now we're gonna talk about the functions, like which functions are performed via this tract. So it includes rapid, skilled voluntary movement, especially at distal end of the limb. So you can see here in the picture, the person is walking. He's using his limbs for that purpose. In the next picture, you could see that a girl is holding a cup of tea. So it also, we can say, maintains the tonic contraction of the muscles and provides stability for walking, as you can see here. Next, there is a person who is trying to open the door, and in the next and also we could say the last picture, we can see that the person is typing. So there are some of the functions that I listed here, but there are many more functions that could be performed. So it's a very important major motor tract. We should keep in mind that its lesion could be very dangerous, and the person could lose the ability to perform the voluntary movements. Now we're going to talk about the origin of this very important corticospinal tract. So it originates by the hexons of pyramidal cells situated in fifth layer of cerebral cortex. So the 2/3 of its originating point is in the frontal lobe, whereas the next 1/3 is in the parietal lobe. So the 2/3 area that is in the frontal lobe, we can also say that it's in the precentral gyrus. This is named according, this area is particularly named because of its function. And then it's further divided into 1/3 and 1/3. The first 1/3 could also be called as the primary motor cortex, or the area number 4 according to Brodmann classification, and the other 1/3 is for the secondary motor cortex, or the area number 6, which is further divided into premotor cortex. Lateral portion of it would be called as that, and medial portion could be called as the supplementary motor area. And next, if we talk about the 1/3 of its origin is from the parietal lobe, that particular point could also be called as the post central gyrus. And here's the area, the primary somatosensory area, or we can say area 3, 1 and 2 according to Brodmann system. Basically, the Brodmann system classifies the brain into about 52 areas, with some present in the frontal lobe, some in the parietal, some in the occipital, and some in the temporal lobe. So from where this particular tract originate, the areas are mentioned on the slide. So I have also added a picture so that you could get a pictorial view and you could have a better understanding of these areas. So you can see here, we'll just talk about the areas with which we are concerned according to our corticospinal tract explanation. So you can see here the area 3, 1 and 2. So it's the primary somatosensory cortex. Okay, so it's present in the postcentral gyrus, and from here about 1/3 of the tract originate, and it's the area present in the parietal lobe. And next comes the area number 4 and the 6 present in precentral gyrus or in the frontal lobe. The area 4 also called the primary motor cortex, and the area number 6 which is further divided laterally and medially, named as the premotor cortex and the supplementary motor cortex. And yeah, so here you can just see and keep in mind, and you would never forget these areas, inshallah. So just see the other areas, how beautifully it's divided, and the brain performs so many functions, just thanks to Allah Almighty. Okay, now starting after origin, now how our track would descend, we'll see that. So first of all, it gives descending fibers that converge in the corona radiata, and then it passes through the posterior limb of the internal capsule. Now, as the track would descend further, so what would happen in the midbrain? It would pass through the middle 2/3 of the crus cerebri. Now here, the fibers that are concerned with the cervical portion of the body, they are situated medially, and the one that are concerned with the leg they are placed laterally. Okay. So next, talking about the pons. When it would enter the pons, the tract would be broken down into small bundles by transverse pontocerebellar fibers, and then it would descend to medulla oblongata. And here these broken bundles that were actually broken down by the transverse pontocerebellar fibers in the pons, they would group together along the anterior border of the medulla and would form a swelling called pyramid. So this is why this tract has an alternative name called the pyramidal tract. This is because it forms a swelling in the anterior portion of the medulla oblongata called the pyramid. So in this way, now it would descend further and would reach the spinal cord actually. Now here comes the splitting and the formation of lateral and anterior corticospinal tract. So what would happen, that most of the fibers at the junction of the medulla oblongata and the spinal cord, they would cross the midline at decussation of pyramid. You could see the area of crossing for the lateral corticospinal tract. It would be different for the anterior corticospinal tract. So keep in mind that they cross at the decussation of pyramids. Okay, and then what would happen, that they would enter the lateral white column of spinal cord to form lateral corticospinal tract. And when we talk about the anterior corticospinal tract, how is it formed? Basically what happens, that the remaining we can say about 10% of the fibers, they descend in the anterior white column as anterior corticospinal tract without decussation, without crossing over, you could see. Next, now at this particular location they would cross and they would reach the anterior gray column of spinal cord at the cervical and upper thoracic segment, not throughout the spinal cord. It would terminate here in the anterior gray column, and so as the lateral corticospinal tract would also end here. But you should keep in mind that it's not present along the entire length of the spinal cord, rather it ends at the it ends at the anterior gray matter at cervical and upper thoracic segments. And from here, when we talk about the lateral corticospinal tract, it also enters the anterior gray matter at appropriate spinal cord level. So this is the termination point for both of them. Next, they would synapse either with the internuncian neurons, or we could say the interneuron in both the cases, or they would or they would synapse directly with the lower motor neuron. Okay, so most of the fibers for the lateral corticospinal tract, they first synapse with the interneurons and then finally with the lower motor neurons. Okay, so now here comes the branches that this tract sends. So this tract sends the branches. First, it gives branches to the cerebral cortex to inhibit the activity of adjacent regions of the cortex. Next, it also gives branches to the caudate and lentiform nuclei, the red nuclei, the olivary nuclei, and the reticular formation. And these branches keep now the function of the branches that were given to the cerebral cortex was to inhibit the adjacent regions of the cortex. And here the branches that are given to these subcortical regions is to inform them about the cortical motor activity, and once they are alerted, they know about that something is occurring in the cortex, like it's performing some activity. So what happens that these subcortical regions, they send their own nerve impulses to alpha and gamma motor neurons by other descending pathways. Okay, now I added this picture so that you could get a pictorial view of a whole of the tract. So first, starting with the cerebral cortex, passing through the corona radiata, the internal capsule, and then reaching the midbrain, passing through the crus cerebri, and then reaching the pons, broken down into bundles by transverse pontocerebral fibers, and then forming a pyramid at the medulla, and then they would divide into lateral and anterior corticospinal tract and would ultimately reach the particular skeletal muscle, or we could say the effector. Next, we will talk about the lesions of the corticospinal tract. So the first thing is that Babinski sign is present. What's the Babinski sign? Basically, the greater toe becomes dorsally flexed, and other toes, they just fan outward if the lateral aspect of the sole is of the foot is scratched. Okay, normally what would happen, that plantar flexion of all the toes would occur, but here in this case, if the corticospinal tract would be damaged, so what would happen, that Babinski sign would be present, and the corticospinal tract would produce this would not be able to produce the plantar flexion of all the toes, because for that purpose corticospinal tract is responsible. Okay, however, you should also know that Babinski sign is normally present in first years of life, because the corticospinal tract is not myelinated, so that's why. Next thing is the superficial abdominal reflexes are absent. So what this means, this actually means that when the abdominal muscles, they are like when the abdomen is scratched, so these muscles would contract. Okay, but since if there would be some lesion to the corticospinal tract, so this tract, basically what it does, it exerts tonic excitatory influence on interneurons, so that function would be lost and these reflexes would also be absent. Next comes the cremasteric reflex. For the same reason, this reflex would also be absent, but what this reflex is, it is that when the skin on the medial side of the thigh is stroked, so the cremasteric muscle would contract. And last, fine skilled voluntary movements are lost, especially at the distal end of the limb. This I discussed very early in when I started this video. You would see, you would also have seen in the slide, the one in which I have mentioned the functions of the corticospinal tract. So it's written over there that it's responsible for fine skilled voluntary movements, especially at the distal end of the limb. Okay, so that's all about the corticospinal tract. If you would be having any query, you can ask. Inshallah, I would answer that. And thank you so much. I'll also upload the videos for other tracts. So stay tuned. Thank you so much and Allah Hafiz.